Hi, I'm Asghar Husain, orthopedic surgeon. Joining me is Krista, Consiglio-Lahti, physical therapist from Arrowhead Orthopedics. We are going to talk about weeks 2 and beyond after rotator cuff repair. You've had a rotator cuff repair. Matt is going to demonstrate as if he had a left shoulder rotator cuff repair. And our goal here is 2. One is we want to protect the repair, so we are pinching the shoulder blades back, protecting the position of the shoulder. But right now, Krista is going to help us demonstrate how do you slowly get movement, because while some stiffness is probably a good thing after rotator cuff repair, ultimately what we want to do is to get all the movement back, and there's some evidence that when you're doing that relatively early, that can help. So the point here is passive range of motion, so we're not trying to move it actively, but what we're going to demonstrate is by protecting the arm and moving the body away, we're going to get the arm moving. So Krista, how would you do this?
One of my favorite ways to start getting a forward elevation or scapular elevation going is to have them use a countertop at home and just place your hand on the counter. Perfect. And don't put any weight through it. I just want it setting there just so it has some support, and slowly walk backwards.
And also to set this up too, pause just a second. So he has had a sling on. Matt has carefully taken the sling off, as we have demonstrated in other videos as far as how to do that. And now he's protecting the arm. He's not going to use any muscles over here. And then Krista is going to continue.
So you're just going to walk back until you feel a light tug. I don't want you to get to a point where it's pinching, it's aching, it's what makes your eyes want to roll back in your head. Nothing like that. I just want to go to where it's a little bit of a stretch and then walk yourself back in. In this instance right now, you're kind of reaching towards that table. I don't want you to reach with the front of your shoulder. Really, like Dr. Husain was saying earlier, keep that shoulder blade activated so it stays back. Also, as you walk, if you feel like you're losing your neck or this part is shrugging up into your ear, really just settle that shoulder blade down. Let it stay relaxed.
And what do you think about rotating his body a little to the right? Because I always worry a little if the arm is going this way, you may be pinching a little bit more. Do you have any concerns as far as that goes? So to the right, this way over here, right? So if you're doing that, it looks like it might be clearing the shoulder. If he's pinching his shoulder blade back just a little bit, the roof is going up, and if his arm is even out a little bit more, we may be clearing. Does that seem reasonable as well?
Yes, definitely.
Meaning what I would want someone not to do is to have this all the way forward as if you're doing this position, because then I'd worry that they're pinching it. Whereas if your body's rotated a little bit further out, you're clearing it just a tad. So part of it, I think you said this already, it's the feel of it.
Right.
How it's actually feeling. When you're pinching the shoulder blades back and you're doing that, how much pain would you say is reasonable for a patient to accept?
I usually tell them don't let it go above 1 to 2 points from where it's resting. So if you're resting at a 2 in the sling, you're with your hand on the counter, as you walk back, don't go 2 points above that.
So this is not a push your way, grit your way through it.
No, this is not if a little is good, more is better.
Yes, this is a gentle nudge.
Correct.
Because I've heard therapists say, nobody here of course, hey, just grit your way through it. So ultimately what you're saying is, hey, listen to your body.
Correct.
If you're doing everything right, if you're protecting the repair, if things aren't getting pinched, it shouldn't really hurt that much.
Correct. It is going to feel stretchy, it is going to feel pulley, you are going to feel other sensations because it hasn't been moving in the last week or 2.
Yeah.
However, it's not, as long as it's not burning, pinching, stabbing, it's usually okay.
Now, based on what we did, we got him to about 45 degrees. If we wanted to get a little bit more, how would you evolve this to go a little bit more?
Keep walking.
So we're slowly leaning forward.
Correct.
Now, how do you keep him from leaning on this hand over here?
I just reiterate it over and over. Don't put any weight through it. Don't keep all the weight in your legs. Shift your hips backwards so that way it really stays down into your hips.
Yep.
No weight onto the hands as you come back. And then really not crossing that shoulder in. Don't let yourself lose your neck. So you really don't want that pulling up as you're coming.
Yep. So you don't want to be shrugging the shoulder.
Correct.
You really want to have that position there.
Right.
So it looks like with this one you can get to about 45 to 60 degrees. Okay.